Hi everyone, welcome back to my YouTube channel and today we are going to talk about Norma Verticalis. So let's start our topic with introduction. Norma Verticalis is superior view of skull. This view demonstrates the outline and surface features of cranial vault. It highlights the parietal bones, parts of frontal and occipital bone, and important sutures that join them. This view is especially useful in studying cranial symmetry, suture anatomy, and surface landmarks. Bone scenes from Norma Verticalis. From above, the following bones are visible: frontal bone that forms the anterior portion of cranial vault, parietal bone that are right and left parietal bones, they form the central part of cranial vault, and occipital bone that forms the posterior part of cranial vault. Shape of cranial vault. The outline of cranial vault is oval or ovoid, that is wider posteriorly than anteriorly. The maximum width is across the parietal eminence. Feature scenes are sutures. First, we will talk about the sutures that are visible from Norma Verticalis, that include coronal suture, sagittal suture, and lambdoid suture. Coronal suture is present between frontal and parietal bones. Sagittal suture is present between midline suture, that is present between parietal bone. And lambdoid suture is inverted V-shaped suture that is present between parietal and occipital bones. Then there is bregma, that is meeting point of coronal and sagittal sutures. It represents the site of anterior frontinalis in infants. And then there is lambda, that is junction of sagittal and lambdoid suture, and it represents the site of posterior frontinale in infants. Then there are parietal foramina, that is small opening near the sagittal suture that are close to lambda. They transmit imagery vein that connects scalp vein with the venous sinuses inside the skull. And then there is vertex, that is the highest point on the skull in the mid-sagittal plane. Clinical significance of Norma verticalis. First, there is bregma and lambda that are important surgical and craniometric landmarks. In infants, the fontanalis, that are short spots, allow for skull growth and are used clinically to assess hydration and intracranial pressure. Sagittal suture is site of potential synostosis, that is premature fusion, and it can lead to scaphosephaly. Emission veins seen through parietal foramina provide a possible route of infection that is present between scalp and intracranial venous sinuses. Conclusion of this lecture video. Norma verticalis represents the superior view of skull dominated by parietal bones with contribution from frontal and occipital bones. Its key landmarks are the bregma, lambda, sutures, and parietal foramina. This view is essential for studying cranial development, surgical anatomy, and clinical conditions affecting the cranial vault. And this was all about Norma Verticalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.